Okay, when looking at your AODA social assessment, you will be completing this again on your movie character. Um, so there are some hints throughout the assessment of questions you would want to answer and that you would ask a patient. Some of this information you will be able to take directly from the movie that you watched. Some of it you'll have to make up. Please remember that it should be realistic. Don't make up, something that's not believable. So you start off with the client's name, the presenting problem. So you would keep presenting problem and then you would write a paragraph. It would be, client is a 46-year-old Caucasian female, married with 3 children, or something to that effect. And then why the patient has come in to seek services. That section should be, a couple of sentences. Then you go to family history and relationships. This should all be in paragraph format as well. You'll want to keep the header, family history and relationships, and then you can remove the hints. So, client was born and raised in Wausau, Wisconsin, was raised by parents, Mary and Paul, you know, so you'll answer all of those questions in paragraph format. You'd want to list like siblings. So if they have siblings, their first name and ages. If they're married or in a long-term relationship, you would want to indicate that. And then children as well, first names and ages. Moving on to the medical history. Health and nutritional status, you can answer these following questions. Do not remove the hints. So medical professional, who their doctor is, any medications that they're on, how long they've been on medications, whether or not they have any allergies. If they don't have any allergies, you can write no known drug allergies. Any history of any head injuries or trauma. How good, are they sleeping at night? How well is their appetite? Moving on then, you go down to childhood and adolescent history. So, client reports childhood as normal. You'd put normal in quotes, or, not normal. So you'll go through that. You'll want to remove these hints and put this again in paragraph format. Social relationships, again, paragraph format. Who they are close with, who makes up their support system. History of substance use, you'll want to indicate, this will be in paragraph format again, include age of onset, duration, and pattern of use, whether or not there's a family history of AODA, what sort of symptoms or consequences are related to their alcohol or drug use. You will want to take this right from the DSM-5. Here are several examples. So repeated attempts to control use. Then you would want to give an example for that. So client has attempted to cut down or eliminate drinking from their life on multiple occasions. However, reports that they were unable to do so after 2 days or something to that effect. For incarceration, client reports 2 OWIs resulting in, incarceration for however many days. Probation, client is on probation for Marathon County, probation and parole with agent so-and-so, and how long they'll be on probation. Whether or not they have any past AODA counseling or treatment history, who they were with, when that was. Any periods of sobriety in the past would want to be noted, whether or not they've ever went to AA, NA, any sort of support group attendance, and then also asking, was that effective? Was it helpful? And then looking at the stages of change, what stage of change do you see your client in? And you would want to note that. So, client appears to be in the pre-contemplation stage of change or whatever. So that would all be in paragraph format. Then going down the chemical use history, you will keep this exactly how it looks. So for tobacco, age of first use, you could put 14 or 13, whatever the age was, and then duration and pattern of use. So client reports smoking a half a pack to 1 pack of cigarettes per day, or client reports chewing tobacco daily, whatever. Same thing with caffeine, alcohol. You go through all of the drugs of abuse. If they don't have any drugs of abuse, let's say they've never used opiates, you could delete the age of first use and duration pattern of use and just put a statement, client denies any use of opiates for that section. So you scroll through all the drugs of abuse, and you get to education, vocation, and employment history. This will be in paragraph format. So education, client reports, they graduated from Wausau West High School in 1999. Client reports, she did go on to college for her bachelor's degree from UW-Stevens Point for early education, and is currently employed for the past 15 years through the Wausau School District at Horace Mann Middle School, or, you know, whatever you're going to put there, but that will need to be in paragraph format. Then you go to the legal history, again, paragraph format, whether or not they're on probation, whether or not they have any current or past legal charges or convictions. If there is no legal history, then you write, client denies any other past or current legal history. Military, you know, if they're in the military, you would indicate that and what branch of the military. If they were formerly in the military, you know, what type of a discharge did they get? And again, that would be in a sentence or in a paragraph format. Cultural, ethnic, religious history, that will be in paragraph format. Identify their ethnicity, their religion, whether or not they practice their religion, do they attend church, do they seek support from their church, is it important to them in their lives, and then any cultural concerns. Leisure and recreational, again, this would be in paragraph format. You know, what are their hobbies, what kinds of things do they enjoy doing. Personal functioning. This will also be in paragraph format. There are a bunch of hints here as to what you would need to write. Then you go down to crisis management and prevention. Again, there's a lot of hints. You will not want to remove any of these. You will just add to them. You want to make sure that you ask whether, you know, in real life, every time you meet with a patient, whether or not they are having any current suicidal ideations, thoughts, plans, intent. You will also want to note on the assessment that a suicide risk assessment had been completed. Okay, moving on to mental health. Again, paragraph format, whether or not there's a family history of mental health, and then whether or not they've ever sought treatment for mental health. Life satisfaction, this can stay as is. This does not need to be in paragraph format. You'll just use the hints to create this, identifying short-term and long-term goals, and then any strengths or barriers. The trauma screening, it's just yes or no answers. And then if yes, you'll want to indicate what. The summary and evaluation is a summary. This should be several paragraphs of what you have found during your assessment. And then the final section is treatment recommendations. So what you foresee for the client, what is going to help them be successful in maintaining sobriety. Again, this should be at least 2 paragraphs, if not more. Also, just wanted to note that in the summary and evaluation section, you'll want to indicate the client's diagnosis and use the DSM-5 to be able to support that diagnosis. If you have any questions, please let me know.